Happy holidays and welcome to the Trading Bell Show. Today we want to talk about matters health with Njeri Jomo, the CEO of Jubilee Health Insurance. We want to talk about the challenge, which is accessibility and affordability, and what they are doing as a company to ensure this happens. Welcome to the Trading Bell. Njeri, welcome to the show.
Thank you, Maina. It's good to be here.
Excellent. And first, I want to start this conversation by saying it's been long. We have been looking for you. Thank God you're here. But first, let me congratulate you, because as I was looking through the year, you've won several accolades. And one of the things that I noticed that you have a remarkable achievement on being named the CEO of the year. And I just wanted to ask you, how does this feel? How is it landing, first of all? And what would you share about this transformative leadership milestone?
Thank you.
Yeah.
So for me, I think winning is an interesting thing. And I say winning is a double-edged sword. You sort of are unsure whether to quite celebrate it or sit in it and think about what did I do different. Mm-hmm. But for me, it's not really just a personal milestone. Yeah. I've been leading Jubilee Health for about 2 years now. Yeah. A lot of great work, a great team. Yeah. So this is not just a personal milestone. Mm-hmm. It's for me a real celebration of the team that I get to work with. The thing about leadership is you're doing everything, but I think what's not seen is it's a very strong support team that on a day-to-day basis enables you to do well. So for me, this celebration is not really just personal. It's everything that we embody and are working on as a team in Jubilee.
Okay, thank you so much, Njeri. And I know leadership is quite a mountain, if I may call it that. And most people don't really give credit to the fact that we may celebrate what we're seeing, just like a building we see, but we have not seen the foundation and things they had to conquer. I just wanted to share one or two challenges that you really see that you had to conquer to get to where you are.
Thank you for that question, Maina.
Yeah.
Leadership, as you said, is not a walk in the park. Mm-hmm. I mean, a lot of people see the beautiful things around it, the fact that you know, the rights that come with that and the privileges, but the responsibilities can be quite heavy. Yeah. It does keep me awake at night that I am taking care of over 200 staff, and these are families, these are responsibilities. It does take, a toll on me every day. I'm thinking about all the policy holders who have chosen to insure with Jubilee Health. Yeah. And it's not just leadership, it's also leadership within the healthcare space. And healthcare is not your typical line of business. It's emotive, because by the time you're consuming healthcare or health insurance, by the time you're utilizing that product, you're in a heightened emotional state. In addition to that, then that can be quite challenging, because you're trying to meet this person at their point of need. Yeah. And in addition to that, I think the other challenge for me is balancing all the stakeholder interests. So you have your staff, you have your shareholders, you have everybody else who's expecting something of you, and balancing all these aspects while still remembering to remain you, and remain authentically yourself. Yes. So these are some of the challenges I think that do come with leadership. I don't think in any way they're exhaustive, but there are some of those that I think I have had to navigate over my period as a leader.
Well, as I said, we shall have another conversation on leadership in itself.
Absolutely.
And of course, I wanted to also mention that I know one of the other stakeholders that you also have to balance is family, isn't it?
Absolutely, absolutely. and it's one it's a non-negotiable for me.
Absolutely.
It's a non-negotiable for me. Family really is an important part of who I am as an individual.
Wow. We'll talk about what you're planning for the holidays. Now, let's get to Jubilee Health Insurance. And I want to appreciate that you're recognized as a leader in healthcare insurance. You've been here for quite some time. And I'm sure most of the people have come across the Reds, if I may call them that. And just wanted to ask you, what are your goals really as the healthcare providers that you are to continuously enhance access? Because as we constantly say, insurance penetration in the country, healthcare included, is still at the single-digit levels. What are your sentiments on this?
Thank you. Jubilee Health Insurance is not just one of the insurers in the country. We are the leading health insurer in the region, have about 1.5 million lives who depend on Jubilee for their health insurance need. Yeah. But the interesting thing about our business, we are a specialist insurer in that all we do every day is health insurance. So what that means is that my staff are not just insurers. I also have medical staff, including doctors, optometricians, and all of these different kinds of specialties to be able to serve the individual holistically. So we specialize in health insurance, and not just health, it's everyone, right from the person who wants an international cover to the person who really wants to be able to pay 200 shillings a month just to be able to afford health insurance. We take care of everyone from individuals to families. And you look at our flagship products, for example, for our retail product, what we call J Care. And J is essentially Jubilee. J Care. So you will find it has aspects, for example, J Junior for children. And you'll find it has J Senior to take care of those in our golden years. So we take care of the entire health insurance spectrum, whether you're an individual, you're an SME, you're a corporate, you prefer international medical, you prefer services that are done on telehealth, you prefer home-based care. So that is really what we do on a day-to-day basis. But coming back to the question on access, and there's a lot of conversations that can be had on what healthcare really is. And again, as I've said, healthcare is emotive. When you're consuming it, you're in a heightened state of mind. But sort of stepping back to healthcare generally, if you go back to the country today, one of the biggest conversations is healthcare. And what insurance is healthcare financing. So insurance really is one of the forms of healthcare financing. And there's many aspects to be said. Is insurance a public good in that it is government that should take care of it, or is it a private good and private sector should take care of it? And from where we sit, it is both a public and a private good in that government has a role to play. There's a critical need for the social layer that takes care of everyone, and then there's the private sector role that then creates the layer above that. So when we go to access, it then means that both must work very well collaboratively to help address the issue of access. But for us, what we've done is made sure that we provide care and affordability right down to the last, as I said, 200 shillings a month. You can be able to do that. We've done something interesting more recently saying we recognize that affordability is a major challenge. So we now enable you to purchase not just your insurance digitally, which means you can do it from wherever you are. We're also saying that you can break it up into installments, and you don't need to do paper. It's essentially done through phone. So as you purchase your insurance, you get to the place of exit and you select the number of installments and you're covered. So I think the conversation on access is big because it's down to providing it, down to affordability, and down to addressing reach to making sure it's accessible to the last person on the ground.
Wow, interesting. I didn't even know that at 200 shillings as well, you're allowed in.
Everyone is allowed
Everybody
in.
is.
Everyone is allowed in.
Excellent.
Yes.
I want to move the conversation still within your confines of Jubilee Health Insurance and talk about your products and innovations. I think I am familiar with the fact that you have to constantly think of how do you innovate to ensure that you're having everybody benefiting from your products and services. What sort of innovations do you have, and are there any in the pipeline as well that you're thinking about?
Thank you. So again, continues to be the conversation on access and reach to make sure that people have both affordable and quality healthcare. I can't underline the conversation on quality because you really do want this person to get well. So there are a couple of things that we do. We provide products, I've said, across the spectrum. We innovate around how to deliver, so we innovate around process. So today, a lot of our solutions are available digitally, whether you're buying from your insurance agent. If you walk up to your bank, ask them for Jubilee Health Insurance, they should be able to provide it for you. So we innovate around how you can access our product. But we innovate further because, as we said, we do insurance and we do it quite well. But that's mostly on the curative spectrum, which is making people get better after they're already unwell. A lot of our innovations have been around the preventive side of it, where we've said, how do we keep you well? How do we keep you out of hospital? How do we keep you on the spectrum of preventative? Such when it comes to curative, it's not probably as expensive or as demanding as it typically would be. And one of the innovations we're most excited about is our telematics and our application called Maisha Fiti. And please download it. Maisha Fiti is on both Play Store and so up in the App Store. Now, what you do with Maisha Fiti, it tracks your steps and it gives you the WHO recommended number of steps you need to walk work
Okay.
as an adult for you to remain healthy. So we track that. It has great communities. Well, you know, we have a moms club, so we discuss with moms. We discuss with moms to be. We walk them through their journeys. We actually have a seasoned woman group for the women going through perimenopause and menopause.
Okay.
We have communities for chronic disease management and lifestyle disease management. And we think that that's great because it's increasingly not just a question of being unwell, it is more on the curative side. But what's more interesting, Maina, is that today we give discounts for people who walk or who are active.
Okay, so Maisha Fiti is going to be helping me get my discounts.
Please get on Maisha Fiti, because if you're putting in your steps, at renewal you have discounts. So we are rewarding you for staying healthy. And we think increasingly this then becomes a conversation. And if you think about it, Jubilee has been driving a flagship initiative called the Grand Nairobi Bike Race. Again, going back to healthy lifestyle. So that's one of the innovations we're excited about. The other innovation that we've done, which I think has been great, is our Always With You proposition, where we're telling you Jubilee is always with you. And that's a big promise to make if you think about it. So what we're saying, if you're unwell, before you even walk into that hospital, call. A health navigator will navigate you through the healthcare journey. So you're saying, I'm feeling this way. They will navigate you to where you get the best care. They will navigate you and help make sure you get the best care during the treatment and post-care, because we also do the follow-up and check how are you doing, have you recovered. We do drug delivery for you. We make sure that we can bring it where you are. If you are in hospital, and you know hospitals at times, we're all not too comfortable, the nurses keep walking in and out. We also avail home-based care through our Always With You proposition. So you could find you're actually getting better because you're in the confines of your home.
In the confines of your home.
And the quality that you're experiencing in the hospital can also be extended to your home. So our innovations have really been on really access and affordability, and also how you consume healthcare, so that then it really is a lot more palatable. What you can look out more for, of course, so our conversation continues to be how we enable people to access health insurance. We think there's a lot of underserved. There's a lot of who are still underserved. There's many conversations on what's the right product. Of course, for insurance, you have an oxymoron. People want to pay the least amount of money but get covered for everything. So we keep really a lot of research, just trying to find out the best fit, a lot of conversations with our customers to find what works for you, so we can make sure that we insure as many people. We're on a bold goal that over the next couple of years, we're trying to cover as much as 1 million households within Kenya, because health insurance really ties to human dignity. Health and human dignity are in the same sentence.
All right. Oh my goodness. This is Jubilee, ladies and gentlemen. And I think I want to appreciate the array of products that you're covering, especially. But still, finally, in that access part, we have the underserved, if I may call them, if I may use that demographic where we have underserved niche markets like gig economy workers and even the rural population. Some of them who probably even insurance is just almost a distant conversation.
Absolutely.
What are your sentiments on that to ensure that they are also included into the affordable and quality healthcare?
Thank you. So again, going back to accessibility and reach, one of the things we're doing quite actively is, one, our propositions are now fully digital, which means you can buy a product from wherever. And this is big because it means you can select and choose the product that you prefer. But there's also, how do you find out more? So it's not just that we are online, but we are really expanding. We're already in most of the major cities around Kenya. We are working on a lot more access, because we want to make sure that you can talk to us wherever you are and begin to discuss a proposition that best fits you. The thing with health insurance, it's not a one size fits all. You really need to discuss to find out what works best for me. And in the innovations we're working on, you'll find a lot of personalization and customization, because we don't want it to be a one size fits all. What works for Maina doesn't work for the next person, and that's really going to be what we think will really address the issue of the person on the ground. For example, think about it. When you look at the different towns, there are towns that depend on mission hospitals quite a bit. It's almost a way of doing things. There are others that really will go to the government hospitals as first point of call. There are others that will gravitate towards private. So when you look at the different behaviors in the different customer pools within the different regions, it then requires us to adopt customized solutions depending on the area that you're in. So it's really understanding the different markets, markets, or the different customers that are in the different underserved areas, understanding the solution that best fits. For example, Nairobi, you like dental a lot, you like optical. For rural Kenya, perhaps that's not the priority. Really, it's just really, and maybe they'll not go to hospital for a headache, and they'll not go to they'll probably go to the pharmacy. So understanding those unique trends and creating solutions that work for them, but also how do they consume them, deciding those who prefer to do it on digital, great. Those who still require some physical engagement to do it, that we avail that to them. And again, back to the price point, making sure that it's affordable and they're able to afford it even as they take care of their typical basket.
Wow, lovely. Let's now move on to the competitive landscape that you have and the fact that you're number one now. I wanted to ask you, what's your competitive advantage?
So again, as I've said, what makes Jubilee different is that we are a health insurer.
Okay.
And there's
sticking to that
some advantage to really being that specialist. And there's a couple of things about health insurance that is quite different from every other line of insurance. You see, it's a couple of sciences. Insurance is already a science because it's risk management, but there's also one that is often spoken about, which is actuarial, which is, I think they taught us about probability and trying to come up with simulations that speak to likelihood of something happening, right? Because we said insurance is a pool. So there's a lot of assumptions that go into it, and then actuarial does that very well. And insurance will then look at, because it's a risk, the likelihood of it happening and so on. But there's also health insurance, which is medical, which is the additional science. So that can make it quite complex. Now, this is an area that Jubilee does exceptionally well. And it's an area we have harnessed. And I've said it's not just paying your bills. I've said it's about, we do what is called value-based care. It is that we analyze your bills. What we do today, we actually use AI for claims adjudication, which means that when your bill comes to Jubilee, it is broken down to the last possible unit, possibly even to the bag that your medicine was packed in.
Wow.
Now, what that does, it enables us to make sure that you're paying for the right things and that you're not utilizing your cover excessively. Now, where does this count? Because you're going to pay for this every year. We need to keep it affordable for you. We need to keep it in a level where you can be able to utilize it for as long as you can. And if it is used responsibly, then you can continue to afford it. But if it is used, because when you go to hospital, it really typically looks like an open credit card, that it can be used for anything. It means that at renewal, you're going to have to pay more. But you may not worry about it if you're insured by your employer, but think about it. We're beginning to see a trend where employers get sensitive about that cost. As it increases, they start stripping out benefits. So there's a role to play in making sure that it's used well. So as Jubilee, we really manage and support our clients in managing the cost. But in addition to that, we manage the value that they're getting. So it's not just about how many times you went to hospital, it's are you getting better? Are you well? And that's what we call value-based care. So we move from counting incidents. You were in hospital 10 times. We're asking why. What were we treating for? What's going on there? Why are you not getting better? And those are the conversations that we have. So it's really not just paying. It's that we really do walk the healthcare journey with you. We help you navigate it and make sure that you're getting the best out of it.
Wow. I have so much to go and very little time. Let's talk about just focusing on the customer. One of the key things I know, I'm also insured by, a health insurer as well. And one of the things that I see is that, you have the claims that you would have. And I know one of the key things that customers are concerned about is the turnaround time of getting their claims back. I'd want you to point into that. And also, looking at the list of providers that sometimes you give, maybe this year we see some of them have been pulled off, others are in. I don't know about the metrics that goes around that. Is it that you have scrupulous providers out there that sometimes you notice, or people are taking advantage of the system? I don't know. So I wanted you to address those two things, especially in a customer-centric point of view.
The journey of offering customer-centric care for health insurance is an interesting one. Remember, we give you the cover, but we don't have control of the value chain. You're going to walk into a hospital, you're going to have diagnostics done, you're going to have drugs prescribed, and that is completely out of our control.
It is out,
and you're going to rate our service based on that experience. And I think that's often quite an interesting one for us. So on the issue of claims turnaround time, we typically settle with the hospitals. And today, after NHIF, Jubilee is the second largest payer for most of the providers within the market. Now, what we do, and I've said, we adjudicate and we use AI so that the adjudication is quite fast. And we're able to make sure that the hospitals are getting their payments on time. And therefore, then the client doesn't feel the friction. But for those who actually pay out of pocket, we have a reimbursement portal. So usually within the reimbursement portal, maximum 5 days, the client has their money. So really, it addresses that. But back to the question on customer centricity. As I said, the minute you begin to consume cover, you're out of our value chain, which means that we have to work with providers who we agree on how they're going to serve you and the kind of care that they're going to provide to you at every touch point. So what we do when we're coming together at a provider listing is deciding what kind of service are we going to offer you. Remember, we remain accountable for your service throughout that entire chain. And therefore, the provider panel will be largely tied to providers who continue to embody the agreed principles of how we will serve and how we will manage the customer through the value chain. And I'd alluded to the issue of value-based care. So that we're moving from a setup where most of the providers and insurance companies depended on incidence rates, what we're calling a fixed cost model. You went to hospital this number of times, and therefore you were treated. So we would measure in terms of average cost was 10,000, and you visited 10 times. So we can easily come up with a cost. We're moving over to a conversation where we're saying, are you getting better? We're moving to a setup where we're asking the doctor, hang on, this person has been there 3 times. There's a follow-up every other week. What are we treating? Now, you need providers who understand why this matters. And they're not seeing you as just an item which they need to cash out on. So the conversation of the provider panel is always, I must admit, a sensitive one. Some clients would prefer that they had their provider. Others will prefer that they had this and that. But the insurance company remains accountable for the process throughout, from when they give you the cover to how you consume it, which means whatever you're experiencing with that hospital becomes their responsibility. And therefore, they will choose the providers that they feel they can be able to work with. Most people imagine that it's just about cost, but it is not really just about cost. It's also about the quality. It's about the alignment on this is how we will serve, because you will find providers vary, right? And you know, you will see most of them go for certifications for quality, for this or that. Some will go for ISO and so on. So you want to look for providers who have alignment in terms of how we will serve and how we share an alignment on how we want the client to be taken care of. We share an alignment in terms of how you manage your medical personnel. You make sure that we are not prescribing what's not necessary just to use their medical card. So those conversations will go on. So those movements do happen, but it's mostly because of the unique nature of the fact that while we will give you the insurance cover, we then must manage how you consume it, and we remain accountable for you even as you consume the product.
Wow. Top of your entry as well is to ensure that you're operating profitably. And I was looking at some of your numbers last year. Impressive. I think you had a 31% increase in gross written premiums and tripled operational cash flows as well. Well done.
Thank you.
And I know you're about to also, close this year. I just wanted to ask you, what's your focus like? I know I don't want to dig deeper into the numbers, but just what's your focus like? Are you still looking forward to some growth?
Medical insurance is interesting.
Yes.
Most people assume we have a lot of money, but I must tell you, if you look at the last Insurance Regulatory Authority report for 2023, most health insurers are actually loss-making, and significantly loss-making. Now, if we go back to how insurance works is we collect premium and we pay out. So for Jubilee, as one of the things that I think we continue to do quite well is conversations on operational excellence. We leverage heavily on technology, and I'll attribute that to part of why then we are doing well. We invest responsibly for where we're able to be able to do that. But we manage the value chain quite actively, because remember, you will receive premium, but then again, you have no control on how many times someone will go to hospital, what they will do, and so on. So I'll attribute our results to our operationalization initiatives. I mean, our operational efficiency initiatives. There's quite a bit of those that we have implemented. But over and above that, what are we looking forward to? I think continue to optimize what we've already built on, continue to innovate around the customer, and continue to give good value to our customers and to our shareholders.
All right. So finally, as we come to a close, sustainability and community engagement. I just wanted you to talk on that, because we are operating in an environment where we are saying we must have corporates that are also concerned about the environment in which they're operating. Wanted to touch on that. How is Jubilee Health Insurance part of that? And finally, any community engagement that you're engaged in?
As you know, Jubilee Insurance is part of the Aga Khan Development Network group.
Okay.
And as part of this, we have pillars that support, that really speak to our sustainability agenda.
Yeah.
We have a very aggressive net zero agenda that really speaks to what, as AKDN groups, we should be able to achieve. But more closer home as Jubilee is an initiative we take on, not really so much as a tick box, but because sustainability is not something we can wish away.
Yeah.
It's a real conversation on not just, our impact and what we continue, the impact we continue to have as an organization to our environment and our governance initiatives and so on.
Yeah.
So for us, we have a couple of initiatives that you'll be glad to know we already run. I've already spoken to one of those.
Yeah.
The Grand Nairobi bike race.
Yes.
What better way to remain fit while making sure the environment is taken care of than to ride a bike? I'm really looking forward to the day I can ride a bike to work in Nairobi. I think it will be good.
Oh, yeah.
Because it will address both of my concerns. It will be health, but it also takes care of the environment.
Yeah, it will be great.
Yes. What Jubilee also does very actively today is we are planting fruit trees and indigenous trees in primary schools in Nairobi. We've done quite a number. And the thinking around it, think about it again, back to health.
Yeah.
Fruit trees, isn't it? And indigenous trees, and making sure we have adequate cover.
Yes.
So that is an initiative that we are quite passionate about.
Yeah.
The other one, which really speaks a lot more to health insurance that we've been driving for about the last 2 years, is our Afya Mashinani initiative. Afya Mashinani means we take healthcare to where it's needed the most, and we work with like-minded partners. For the last couple of initiatives, we've gone to Meru, we've done one to Nairobi, Naivasha, Nakuru, where we go and provide treatment and provide medication, and we've been working very closely with Aga Khan Hospital Nairobi to do that. So what we do is provide care to those who need it most. And if you think about it, for most of us, we pass 3, 4, 5 hospitals, choosing the one we want to go to.
Yes.
The person out of Nairobi doesn't have that option. They go to the nearest one to them. Yeah. So it's an initiative we're quite passionate about because it brings in the underserved into the conversation. Many other conversations continue, mostly around the underserved, who we think really should have some form of health insurance. Again, back to the issue of human dignity. But sustainability, as I've said, is not something that we talk about as a side conversation. There's so much that Jubilee is doing and so much that we'll continue to hear about, but those are some of those that we are currently running.
I love that. And I also look forward to the day I'll just come here with a bike, I've seen in other countries happening. That
will be good, right?
That'll be good. Okay. Absolutely. Finally, what's your vision like? You're the CEO. I'm sure you have plans 5 years from now. Our next interview, we shall be talking about what?
I am passionate about the impact around healthcare.
Okay.
As I've said, for me, the initiatives around health, human dignity are a big conversation, and healthcare and education fall right in the middle of those. Yeah. So for me, really is for us to continue to drive our agenda on healthcare. Okay. Continue to make sure we have as many people accessing quality and affordable healthcare as is necessary, because we can't speak to it enough. And there's a lot of conversations on everybody else. Is shift coming in? Is who coming in? I think we all must come in because of how significant the conversation is. From the numbers we're looking at, from our disease trends, the disease burden is increasing. Yeah. We are seeing lifestyle diseases coming in earlier and earlier. Yeah. And that is a real conversation for us in terms of what can we do about this? Is it just waiting to pay for it? Or can we actively make sure it doesn't happen to begin with? So this is an area I think that we will put a lot of focus in to be able to ensure that that we can have a real impact within our country and to the people that we serve.
Thank you so much, Njeri, for your time.
Thank you.
But before I close as well, it's the Christmas season. What's your plan?
Oh, many plans. I can't wait to spend time with family. As I said, I'm big on family. Okay. So I'm really looking forward to spend some much needed time with my family. Yes. Okay. Yes.
I have a gift for you after the show. Oh, wow. Did you come with one for me? It's a give me time as well. Just putting you on the spot.
Oh, you put me on the spot on that one. You get one. You get one right after this. Yes, after this. Thank you so much. But you'll have to declare. It will be below the amount that you need to declare for compliance purposes.
Yes. So happy holidays and Merry Christmas.
Thank you.
I think you should also tell the viewers the same thing. Please go ahead. Yes.
To all of you, it's a festive time of year, compliments of the season. I want to take this opportunity to wish all of you and your loved ones a merry, merry Christmas and looking forward to 2025. What I want to encourage all of you, what we say at Jubilee, there's living and there's living free. So we want to welcome you to the side where we are living free.
Wow, thank you so much. There you go. There's living and there's living free. That's how we close the conversation. I leave you now with the markets. Merry Christmas and Happy New Year.